This is the lab for PTA 103 for techniques for the sensation component of our class. This is available for you on Blackboard to review, but I did want to talk through this so that you could start thinking about it and also watch the video related to our sensation lab. So the first thing that we're going to talk about is touch awareness. So light touch as well as sharp versus dull. Usually we want to test our light touch sensation before we do any of our modality application, but we will also want to do this after a lot of our modalities. So first things first, we need to do a visual inspection of our patient, check their integrity of their skin before we then apply our modality. So talking about light touch first, so light touch can be done using several different tools. You can use a camel hair brush, which is very light. You can use a piece of cotton, like a cotton ball or a Q-tip. You can use a tissue. You can also use your fingertip. It depends on personal preference. It may also depend on the patient. The other thing that we're going to look at is pain, which is our sharp touch. So we want to know, can your patient detect light touch and can they detect sharp touch? Your sharp touch can be done with the end of a safety pin or kind of a sewing pin. You can also use a very large paper clip. The idea is that you're going to have your patient discriminate between sharp and dull. But keep in mind that with our sharp tool, we don't actually want to puncture the skin. We don't want to draw blood. That's a bad thing. Okay? We just want them to discriminate a more painful sensation. So starting with our light touch, we're doing this to determine the patient's perception of tactile touch input, okay? So the area that we're being tested is going to be the area that we're using our modality or we're applying our treatment. Okay, it's going to be touched very lightly or possibly stroked. We don't recommend dabbing or kind of dots in the area. We don't want you to brush back and forth. That can be too much sensory input for your patient. And what you want your patient to tell you is either yes, they feel it, or no, they don't feel it. So you can either have your patient say yes or no, or okay, or I feel that, whatever cues you want to give your patient. Now, sometimes I want to add, patients will sometimes say, well, I don't know, I feel a little something, but I'm not really sure what it is. You can go from there and determine a more advanced sensation evaluation, but that is not what we are going to be focusing on for now. Our sharp-dull discrimination, looking at our pain sensation, okay, we're looking at the function of the patient's protective sensation. Okay, so if someone has impaired sensation and they touch something hot or they step on a nail or a tack, are they going to feel that? That's really important information to know. So we're going to use the sharp end and the dull end of some type of tool or instrument. Like I said, you can use a safety pin, you can use a paper clip. Again, remember, we don't want to necessarily puncture the patient's skin. And we're going to do this testing in the area where we're going to apply our modality. Okay, so you want to apply your sharp-dull discrimination in an area where you're doing your treatment, but you don't want it to be too close to one another. So you're going to test one end and have the patient determine, is that sharp or is that dull? But you don't want to do your next test very close next to it. It may be challenging for the patient to decipher between that. You also don't want to go too fast where your patient can't follow what you're doing. But keeping in mind, you do want to alter the speed at which you're applying your sharp-dull sensation. Okay, so your patient, you want them to say sharp or dull. And I definitely recommend using a uniform pressure with each time you're applying your pressure, because if you push harder with the dull side and lighter with the sharp side, it's going to give them challenging input. They're not going to be able to process that. So we will actually go through and demonstrate this in lab. There is a video available on Blackboard. I'm going to switch to Blackboard real quick. So if you go under course content in your techniques folder and then click on videos, there are several different videos here for all the different modalities that you're going to be using. The skin integrity check video is the one linked to what we're talking about in lab today. This was done by a previous instructor who did a great video. It's just another tool, another resource for you to use. But we will go over this in class. So some things to consider with our light touch and our sharp dull discrimination tests. You always want to make sure that you demonstrate this for your patient first in an unaffected treatment area. I usually use the back of the patient's hand and I let them watch and I show them, this is what my light touch test looks like, or this is what my sharp dull test is going to look like. This way they can see and they know what I'm going to be doing. When you're doing this test, you usually want to start distally and move proximally. You want to be above and below the treatment area, but you also need to actually test the treatment area itself. You don't just want to test above and below that area. Okay, really we want to know, is there sensation intact in the area where we're applying our physical agent? You want to have your patient's eyes closed, because if they have impaired sensation and they can see, they may cheat. Okay, they may go by visual response rather than tactile cues. Okay, you do want to vary your tempo, but you don't want to go so fast that your patient can't respond. And you want to test this bilaterally. So if I'm demonstrating in an unaffected area and I'm using the back of the hand, but I want to apply my cryotherapy to my left knee, I'm still going to do my sensation checking to my right and my left knee, because I want to know, is their sensation at their knee the same bilaterally? Because some people, maybe they have decreased sensation on both of their knees because they have a job where they're kneeling a lot or they're doing construction and they have, previous injuries. So I always want to test bilaterally. Now, if a patient has impaired light touch, you want to move on to see, well, if they don't feel light touch, can they discriminate between sharp and dull? Because that is much more of a safety issue. Okay. A few other things that we are going to evaluate with our sensation testing and our examination. We want to evaluate the skin temperature. Okay, so we're going to evaluate the temperature by palpation, so we're going to be touching the area. Superficial skin changes can indicate what's going on with the patient. They can indicate the pathology. If they have decreased temperature, then my guess is that they have poor circulation. If they have increased temperature, they may likely have an infection or some type of disease. They may even have inflammation, because that is one of the key components of inflammation, is increased temperature to the area. So what you're going to do is you're going to use the back of your hand, okay, to evaluate the treatment area, and you're going to compare it to the contralateral side. So you're going to test bilaterally. The reason why you want to use the back of your hand, okay, is that the palmar surface of your hand, the temperature can be variable. So it's better to use the back of your hand to check the temperature. Capillary refill, we're going to test this by either using the nail bed of either the fingers or the toes, or we can also do it in the treatment area that we're working on. So the capillary refill, we're looking at the time that it takes for the capillary bed in that area to refill after we've occluded it by applying some pressure. Okay, so this is going to indicate the amount of perfusion to the extremity. So that means, is there enough blood supply, is it adequate blood supply to the area where we're applying our modality, which is important. So we're going to do this by applying a firm pressure over the treatment area or the nail bed, whichever area we're doing, until the skin blanches, so it turns white. Then we want to release the pressure, and we want to note the time that it takes in either the nail or the area to regain that full color. So if the color returns in less than 2 seconds, that's a normal result. If it takes more than 2 seconds to return, that's going to be an abnormal finding. The other thing that is not on this lab handout that I want to stress is that you also need to do a visual inspection of the area. You need to look to make sure that there's no open wounds, there's no scarring, there's no tattoos. If there are tattoos in the area, that may affect our capillary refill. It could potentially affect our sensation check. It's something to keep in mind and something we would need to note or document. Okay, that will all be what is stressed for our testing purposes for competency. Another thing that I thought was really important that I put on here anyway is about the edema that we may see in patients' extremities. So you may have seen patients that have really swollen legs or arms or different parts of their body. We can use our pitting scale to evaluate that. So the pitting scale evaluates the time it takes for the skin indentation to resolve after palpation. So this is a good indicator for edema, secondary to inflammation, or some type of vascular disorder, so it could be related to cardiovascular problems. But keep in mind that if somebody has a very edematous or very swollen part of their body, it's going to be kind of painful for you to be applying pressure there. So you have to be considerate of how much pressure you're applying. So you're going to press down firmly on the patient's skin with your thumb or your finger. Remember, you want to test bilaterally. And what you're looking for is, again, the time that it takes for the skin indentation to resolve, essentially. So you want their skin to go back to its resting state. So we're going to grade this as a 1+ if the indentation is barely detectable, a 2+ if the slight indentation is visible when the skin is depressed but returns to normal within 15 seconds. We give it a 3+ if it takes 30 seconds, and a 4+ if it takes more than 30 seconds. Okay, that will not be part of our testing, but it's something that I think is important for you to learn and understand. The other thing that I wanted to talk about is the competency that you will have related to the skin and tissue integrity testing. Okay, this is an example of what your comp form will look like. I will be handing these out in class, so don't worry about it. But essentially, these are similar to your other comp forms. Okay, you're going to grab all the equipment that you need. Maybe you need to grab your paper clip or your safety pin, a tissue, whatever you need to evaluate your light touch. Remember, you're also doing skin temperature, capillary refill, and then your sensation as well as your visual examination. And you'll need to let your proctor know whether what you're finding is normal or abnormal. So whatever equipment you need, make sure you grab that. Obviously, make sure you wash your hands. You're going to introduce yourself. Confirm you have the right patient, explain to them what you're going to be doing, what they should expect, and make sure that they're okay with you working with them, and then making sure you're stating any contraindications. So one of the things I want you to think about is what some potential contraindications might be to doing this testing today. Okay. So the first thing that you're going to do is you're going to do a visual examination of the skin integrity and verbalize those findings. So that's looking for, like I said, open wounds, scarring, maybe bruising, discoloration, any tattoos, anything like that should be verbalized, making sure you're interpreting correctly. There is an open wound here, so yes, that's a contraindication. Or I don't see anything that could be a contraindication, so I'm going to move forward. You're going to correctly evaluate skin temperature and determine, is the temperature normal, is it increased or decreased, and what that means. You're going to evaluate capillary refill. So again, depending on the part of the body, if you're treating the shoulder by evaluating the capillary refill at the fingers, that doesn't necessarily tell me how the blood flow is at the shoulder. So make sure that you're testing the treatment area where your physical agent is going to be applied, as well as areas above and below your treatment area. Okay. You'll also be doing your light touch as well as sharp dull discrimination. Again, explaining the procedure to your patient, what they should be finding, and then explaining to your proctor the interpretation of your findings. We're looking for you to kind of clean up your treatment area, communicate your findings to your patient, and kind of finish up or wrap up that session with your patient in an appropriate manner. Usually that's something along the lines of, we've completed your testing, there's no abnormal findings, so we're going to move forward with our physical agents, or maybe there are some concerns, so we're going to modify our treatment, whatever you might have found during your skin and tissue integrity assessment. You will have 10 minutes to complete this, and there will not be any SOAP notes or documentation for this. So start looking through this lab, make sure you watch the video that's available on Blackboard on the skin integrity check, and make sure you come to class with any questions next week or later on this week.